Welcome to my YouTube channel RN Medicina. Please subscribe. Today our topic is anatomy and physiology of larynx. Larynx. The larynx is a cartilaginous segment of the respiratory tract, located in the anterior aspect of the neck. The larynx, voice box, sound box, or phonic box is a short passageway between cervical vertebrae C3 to C6. Connects the laryngopharynx with the trachea. Lies in the midline of the neck. Anterior to the esophagus. Structures associated with larynx. Superiorly. The hyoid bone and the root of the tongue. Inferiorly. It is continuous with the trachea. Anteriorly. The muscles attached to the hyoid bone and the muscles of the neck. Posteriorly. The laryngopharynx and 3 to 6 cervical vertebrae. Laterally. The lobes of the thyroid gland. Cartilages of larynx. The wall of the larynx is composed of 9 pieces of cartilages. 3 singular cartilages. Thyroid cartilage. Epiglottis. Cricoid cartilage. 3 pair cartilages. Arytenoid cartilage. Cuneiform cartilage. Corniculate cartilage. Thyroid cartilages. Most prominent laryngeal cartilage. Consists of 2 flat pieces of hyaline cartilage, or laminae, fused anteriorly, forming the laryngeal prominence Adam's apple. Lamina is the flattened or arched part. Immediately above the laryngeal prominence, the laminae are separated, forming a V-shaped notch known as the thyroid notch. Incomplete posteriorly. Posterior border of each lamina is extended to form 2 processes, called the superior and inferior cornu, a horn-shaped projection of the thyroid cartilage. It is present in both male and female. It is usually larger in males due to male sex hormone, testosterone. Epiglottis. Epiglottis is a small, leaf-shaped sheet of fibroelastic cartilage that protects your larynx voice box and helps you swallow. Attached to the inner surface of the anterior wall of the thyroid cartilage immediately below the thyroid notch. It rises obliquely upwards behind the tongue and the body of the hyoid bone. Covered with stratified squamous epithelium. If the larynx is likened to a box, then the epiglottis acts as the lid. It closes off the larynx during swallowing, protecting the lungs from accidental inhalation of foreign objects. Cricoid cartilage. Lies below the thyroid cartilage. Composed of hyaline cartilage. Shaped like a signet ring. completely encircling the larynx with narrow part anteriorly and broad part posteriorly. The broad posterior part articulates with above, with arytenoid cartilages below with inferior cornu of the thyroid cartilage. Paired cartilages. Arytenoid to pyramidal-shaped cartilages above lamina have synovial joints with cricoid. Corniculate nodules above arytenoids in epiglottic folds. Cuneiform, rod-shaped, above corniculate cartilages. Arytenoid cartilages. To pyramid, triangular-shaped hyaline cartilages. Situated on top of the broad part of the cricoid cartilage. Forming part of the posterior wall of the larynx. Give attachment to the vocal cords and to muscles. Lined with ciliated columnar epithelium. Corniculate cartilage. To horn-shaped laryngeal cartilage. Made up by elastic cartilage. Located at apex of each arytenoid cartilages. Supporting structures of epiglottis. Cuneiform cartilage. To cuneiform cartilages. Club-shaped elastic cartilages. Supports the vocal cords. Structure of voice production. The mucous membrane of the larynx forms two pairs of folds. Superior pair. Vestibular folds or false vocal cords. Inferior pair. Vocal folds or true vocal cords. The space between the vestibular folds is known as the rima vestibuli. The vocal folds are the principal structures of voice production. Deep to the mucous membrane of the vocal folds, which is non-keratinized stratified squamous epithelium, are bands of elastic ligaments stretched between the rigid cartilages of the larynx, like the strings on a guitar. Intrinsic laryngeal muscles attach to both the rigid cartilages and the vocal folds. When the muscles contract, they move the cartilages, which pulls the elastic ligaments tight, and this stretches the vocal folds out into the airways so that the rima glottis is narrowed. Contracting and relaxing the muscles varies the tension in the vocal folds, much like loosening or tightening a guitar string. Air passing through the larynx vibrates the folds and produces sound phonation by setting up sound waves in the column of air in the pharynx, nose, and mouth. The variation in the pitch of the sound is related to the tension in the vocal folds. The greater the pressure of air, the louder the sound produced by the vibrating vocal folds. When the intrinsic muscles of the larynx contract, they pull on the arytenoid cartilages, which causes the cartilages to pivot and slide. Contraction of the posterior cricoid muscles, for example, moves the vocal folds apart. Abduction thereby opening the epiglottis. By contrast, contraction of the lateral cricoid muscles moves the vocal folds together, adduction, thereby closing the epiglottis. Other intrinsic muscles can elongate and place tension on, or shorten and relax the vocal folds. Function of larynx: production of sound, speech, protection of the lower respiratory tract. Thank you for watching. Please subscribe my channel for more information.